Welcome to the pre-transplant kidney educational session. To begin this introductory module, I will first talk a little bit about the basics of kidney disease and how the main transplant program works to help patients receive life-saving transplants. Then I will discuss the benefits and risks associated with transplantation as you begin to consider whether or not you want to pursue transplantation. If you are watching these modules, that means that you are either on dialysis or have a kidney function of 20% or less. It is likely that your nephrologist has referred you or is in the process of referring you to the main transplant program. One of our program's top priorities is informed decision-making. As you can see in the picture below, informed decision-making means that you as a patient are making an educated decision as to whether or not you want a transplant. Informed decision-making means that you understand the risks and benefits of transplantation. You have a good sense of alternative treatments, and you understand the nature of transplantation as a treatment option. Lastly, you should feel welcome to ask questions at any point during your treatment. Our team members at the Transplant program are always willing to address any concerns you may have. Finally, once you visit the Transplant program, you must read through and sign the Kidney Recipient Consent for Surgery, which reviews transplantation. Even though this may be a refresher slide for you, what is the function of your kidneys, and why does transplantation even exist as a treatment option for kidney disease? Your kidneys are crucial for your survival. Although there is a 1 in 750 chance that someone may only have one kidney, most individuals have two. They filter cellular waste and excess fluid from the bloodstream. All cells take in oxygen and food and release waste from the blood. That cellular waste and the fluid we take in from whatever we eat and drink throughout the day is filtered out by the kidneys. The kidneys also release hormones that control how much calcium our bones absorb and send signals to the bone to make new red blood cells. Red blood cells are the cells that carry oxygen and food to our other cells. When the level of red blood cells drop in our blood, we become anemic, which can lead to fatigue or tiredness. Today, drugs can replace these hormones, but the naturally made hormone is the better solution. Kidney disease can impact your body's ability to clean and filter waste from your blood, and it can affect your blood pressure control. Without treatment, kidney disease will get even worse. To assist patients with kidney disease who are looking for a kidney transplant, the main transplant program opened in 1971. Since then, we have performed over 1,800 kidney transplants, which averages to about 50 to 60 kidney transplants per year. We are the only center in Maine performing transplants, and our success rates for transplant and patient survival after surgery are some of the best in the country. We are located at 19 West Street in Portland, Maine. If you end up choosing the main transplant program, you will become part of a very collaborative and communicative transplant team. This team is comprised of many people who have skills in certain areas. However, the most important member on this team is you, as the patient. Other team members are here not only to help provide you with information, but also to recognize that you have the power to choose your own treatment plan and to consider all options for treatment before you make an informed decision. Members of the team who will help you through the process include the transplant nephrologist, who will determine if you are suitable for transplantation. They will work with the surgeon, who will explain the benefits and risks of surgery. There is a transplant nurse coordinator, who will place you on the waiting list for transplant and will provide you with information about the evaluation process. You will be assigned to a certain coordinator and will be given his or her contact information if you have any questions. There is a social worker who will evaluate your psychiatric needs and support system. A living donor team will work with your living donor if you have one. A financial coordinator will discuss costs and insurance coverage. A dietitian will discuss your lab results, nutrition, and help make sure you are eating a healthy diet. A pharmacist will discuss your current medications with you and will talk about the anti-rejection medications you will take after transplant. They will explain the doses and side effects of these medications. Here is a picture of the pathway to transplantation for the main transplant program. It is a picture of the process that you will undergo until you are listed as a candidate for transplant. After receiving a referral from your nephrologist, you may choose whether or not to attend a class at the main transplant program. If you prefer to continue self-education with these online modules, you'll be given access to more of them after your referral. The modules should be completed prior to Visit 1, which is your first time meeting with many members of the transplant team. You will be expected to complete some routine testing explained in another module before you come back to the program for your Visit 2 appointment. This appointment will discuss the surgery in more detail and review the medications you will take after transplant. Finally, your coordinator will present you at a meeting, and you'll be either listed, turned down, or deferred, meaning that you have to complete some more testing before you can be listed. The time it takes from being listed to getting a transplant varies depending on the recipient. Ideally, we hope to have the entire evaluation completed in 6 months so that you can get on the list for a transplant as soon as possible. Now that you know more about our program and making an informed decision, it is time to consider whether or not transplantation is the best treatment option for you. The goals of this module are to help you understand your treatment options, which include dialysis or transplantation. We also want you to understand the pros and cons of transplantation, especially compared to dialysis. I recommend that you start writing down a list about why you would want a transplant or why you wouldn't want a transplant. This will help you make an informed decision, and will help team members work with you based on your needs and goals for treatment. While you consider transplantation, make sure to keep your personal values in mind. You probably already know the two main treatment options to help treat kidney failure. One option is dialysis. Dialysis uses a filtering machine or special fluid to remove waste out of your body. Hemodialysis is when a machine cleans your blood at either a dialysis center several times a week or at home every day or night. Peritoneal dialysis is where a fluid is put in your stomach to clean your body and then taken out a few times a day and overnight. However, you probably know less about transplant. There are two types of transplants. A living donor kidney transplant is a surgery where doctors put a kidney from a living person into someone whose kidneys no longer work, and a deceased donor transplant is a surgery where doctors put a kidney from someone who has died into someone whose kidneys no longer work. An important thing to remember is that both dialysis and transplants are treatments, not cures. You must still take care of yourself, and you are responsible for keeping yourself healthy after treatment. When it comes to transplantation, here are the potential pros and potential cons to consider. I've used the word potential here because these pros and cons may or may not apply to you. Each person will have a different experience with transplantation, both before, during, and after. However, one of the common potential benefits is the fact that you no longer will have to attend dialysis. This means you'll have fewer dietary and fluid restrictions, you will have more energy, and you can return to a lifestyle that you are more familiar with, including the fact that you may be able to go back to work. Transplantation is also likely to increase your life expectancy compared to being on dialysis. However, due to surgery, there is a small risk of death. Approximately 5% of patients nationwide will die after the first year of transplant due to complications with the surgery. The risk of death is highest within the first 3 months after surgery. Once you have a transplant, you also must take lifelong anti-rejection medications. These medications keep your transplanted kidney functioning, but there are side effects from them that will be explained in the next slide. I mentioned anti-rejection medications in the earlier slide, but what are they, and why would you need to take them? The trillions of cells that build our bodies have a pretty cool system set up that keeps us healthy. The cells that make up our immune system, which keep us from getting sick and fights off bad foreign bacteria or viruses, have a special code that they use to recognize what things are part of our bodies and what things are not. When you have a transplant, the kidney that will be in your body is most definitely not recognized as a friendly face to your immune system. It is from a completely different person. Therefore, the medications will trick your immune system into letting the kidney stay in your body and become your friend. Therefore, the name anti-rejection medication fits the function perfectly. However, you must keep in mind that these medications can have side effects. Some side effects include tremors or shaky hands, difficulty sleeping, weight gain, upset stomach, and headaches. Your risk for cancer increases. One of the highest risks is skin cancer, which 50 to 60% of patients will have over the course of 10 to 20 years after they get a transplant. Also, since your immune system is suppressed, you are 40% more likely to have infections during the first year after your transplant, because your body can't fight off diseases as well. If you do not have diabetes, there is a 20% chance that you will become diabetic after your transplant. More information about these medications will be discussed in a later module, but the bottom line is that if you are considering transplant, you must take these medications for the rest of your life after surgery. Therefore, you have to understand that even though these medications will prevent you from losing your transplanted kidney, they have their own risks that should not be taken lightly. I already talked about the potential pros and potential cons to transplantation. This speaks to the fact that there are uncertainties with this treatment, and this is because, like I said, every person is different, and therefore every person will have a different experience with transplantation. For example, some patients may experience side effects from the medications, and some patients may not. Some patients may have to be hospitalized after they get a transplant, and some patients will be fine. Remember that we cannot predict exactly how your surgery will go or how successful your transplant will be. This is true with any medical procedure. Despite these uncertainties, there are ways in which you can make sure that you are treated appropriately in order to become healthier. Think about whether or not transplantation is right for you, and remember that your transplant team will be with you every step of the journey to help keep you healthy and to resolve uncertainties as much as possible. They are professionals who have helped more than 1,000 patients have successful transplants. Therefore, it is important that you not only make an informed choice, but that you listen and follow advice from your team members. That way, you will be prepared for all of the potential outcomes, both the good and the bad, after transplantation. Next steps. Now that you've been introduced to transplantation, think carefully about the choices available to you for treatment and what option seems the best for you. Contact your nephrologist or the main transplant center if you have any questions. If you have written anything down about your concerns for transplantation or what motivates you to get a transplant, compare these benefits and downsides of transplantation to your personal values when making a decision. Lastly, if you want more information on transplantation, you can continue to Module 2, Requirements to be a Transplant Candidate.